We also have what's normal curvature of the spine. The cervical vertebrae have an anterior curvature towards the front of the body. The thoracic has a posterior curvature towards the back. Lumbar has an anterior curvature towards the front. If the thoracic curve is an exaggerated curve, too much of a curve, it's called kyphosis. You can think of it as like humpback. If the lumbar curve is too much of an anterior curve, it's called lordosis. You can remember that because the L in lordosis and the L in lumbar go together. Okay, and that's like sway back. Or if you have an S curve of the spine, then that is called scoliosis. Then we went into each of the muscles. So you have the trapezius, which originates along the occipital bone, the nuchal ligamente, and then part of the thoracic. And it inserts along the spine of the scapula, the acromion, and part of the clavicle. At home, you can feel that by palpating or grabbing at the very top of your shoulder joint. That's the top of your trapezius. It's a fat, thick muscle you can grab. And you can kind of feel it attaching to your clavicle and up along your spine of your scap there. You can also palpate it at home along the very back of your neck. On one side you can kind of see it and feel it come all the way up to your occipital bone as well. Okay? So then we learned that it will elevate the scapulas, it will retract or pull them together, it will depress the scapulas, it will do a few other things, but for now that's what we're going to focus on. Okay? We have levator scapulae, which originates along the transverse processes of C1 through C4 and inserts on the superior border of the scapula. And just like the name indicates, it elevates the scapulas. What we didn't talk about, but what we will talk about, is the fact that it also, if it anchors down here, it will also laterally flex the neck, which takes the neck down to the side. So it's pulling this down this direction. And then the third muscle was the rhomboids. Rhomboids are deep to the trapezius. Rhomboids originate along the part of the thoracic here and come down at an angle and insert on the vertebral or the medial border of the scap, and they retract the scapula together. So you have two muscles that do the same thing. The rhomboids and the middle trap both pull the scapulas together, they retract them. The upper trap and the levator scapulae both elevate. That's the one where I had you guys shrug your shoulders up, right? Elevation of the scapulas. Some just terminology defined. Anatomy, study of the body. Anatomy. Physiology, study of the function. Pathology, study of disease. Kinesiology, study of movement. We made sure we knew that origin is the non-moving bone, insertion is the bone that moves, and that the insertion moves towards the origin. That's how you can figure out the action. Am I missing anything?
Rules.
Okay, general rules of muscles to help you study is most muscles cross at least one joint or else you can't have movement. The origin anchor is the anchoring bone, insertion is the moving bone. We talked about that muscles can only contract, they never push. So if you're thinking of an action of of a muscle and you're making it push something out, then you have the wrong action in your head. You always need to remember that the muscle can only contract, kind of like a puppeteer. It can only pull together, never push, right? And a lot of muscles are named for, most of them have some reasoning behind their name, based on a shape or a location, or maybe a combination of those two, or maybe a function. So always look at, when you're learning the name, look at the name. Some helpful hints of studying is to maybe do flashcards, to draw, to say the name out loud, to palpate, to find it on another person, to explain it to another person, make that person do the actions and say the actions out loud. Get a general idea of where the muscle is on the body, just an overall general idea of where it is. And if you're someone who likes definitions with terms, you can go through that definition sheet if that will help you. And that's it. It's a lot up front, and we will go over this more. Don't worry much about your quiz. It's just to see where you're at and hopefully kind of keep you organized as we go along. Anything else that I missed? Any questions? Okay, I think we're done.